Hey, what if I told you that I can cut through your brain and you still won't feel any pain? Is it true? Well, it is true because brain does not have representation of itself. Now, what does this mean? For that, let's first understand how do you normally perceive pain. There are something called as pain receptors which get activated when it gets some unpleasant painful stimuli. So when these pain receptors get activated, they send the signal either through the peripheral nerves and then through the spinal cord to the brain, or in case of head and neck region, through the cranial nerve to the brain. This is what happens normally, and this is how you perceive pain. And in the brain, there are different areas where these signals get processed. But let's not go into the details of these. The brain has a map of the entire body, and using this map, it localizes the signal to be coming from that specific area. But brain does not have its own location in the map. That is, it has hand areas, leg areas, mouth areas, finger, everything. But there is nothing called brain area in that. So brain cannot perceive something which is coming from itself. And this is why brain will not feel or sense any pain if I cut the brain. So the next question would be, if there is no pain associated with brain, why do we need anesthesia in brain surgeries, right? But remember, to reach till that point, we need to go through multiple layers which obviously sense pain. That is, we need to cut the skin, which is very much pain sensitive, followed by the bone, that is the skull, which has a covering of what is called as pericranium, which is also pain sensitive. And then there are different layers of covering of the brain, important being dura mater, which is very much sensitive, especially to stretch. And along with that, there are multiple different blood vessels in the brain which are also sensitive to pain, but in some other way, that is, they are more of sensitive to stretch. But yes, this concept is definitely made use of in a type of operation called as awake craniotomy, where we actually perform different operations on the brain and remove some abnormal parts like tumors from the brain when the patient is actually awake and performing some activities like maybe moving of hands, legs, or maybe speaking, etc. So when do we do this awake craniotomy? We perform this operation when we have to operate on the part of the brain which is very close to some of the important parts, like areas of the brain which are responsible for the movements of the limbs, hands or legs, areas which are responsible for speaking, etc. So what do we do? This is more of taken care by our neuroanesthetist. They give mild sedatives along with local injections to the scalp, that's called as scalp block. And then once we reach the tumorous part, we ask the patient to keep performing the activities which are at risk of damage because of the operation. For example, when we remove the tumor, if the tumor is very close to the leg area or the hand area, we ask the patient to keep moving that part. Or say if it's close to speech area, we ask the patient to keep talking so that we can ensure that this important part of the brain is not damaged and the function is preserved. Here in this video, I am excising a brain tumor which was very close to patient's hand movement area while the patient is fully awake, and my anesthetist colleagues are ensuring that the operation goes smoothly, patient is fully pain-free and comfortable, and also making sure that the patient is able to carry out the limb movement.
കൈ പിടിച്ചേ, തലയാട്ടണ്ട, കൈ പിടിച്ചേ. ആ ശരി, കാല് വിരലാട്ടേ. മതി. വെള്ളം കുറച്ച് കഴിഞ്ഞിട്ട് കുടിക്കാം. കുറച്ച് കഴിഞ്ഞിട്ട് കൊടുക്കാം. ശരി. കുറച്ച് കഴിഞ്ഞിട്ട് ഓപ്പറേഷൻ കഴിഞ്ഞതിന് ശേഷം പോവാട്ടോ.
I hope you like this short bit of information about the brain. If you did like, make sure you give it a thumbs up, share it with your friends and family, and for more such interesting videos, subscribe to this channel. Thank you.